Good day everyone, my name is Jovan Castillo. Today I am going to palpate the surface anatomy of the lower limb and demonstrate the movements of the synovial joints. But firstly, I want to make a simple explanation or brief explanation about how relevant is the skeletal system to the nursing student to study. Skeletal system is crucial for nursing students. Humans depend on the skeletal system to support and protect important organs. Understanding human anatomy and physiology requires knowledge of the skeletal system. To offer proper treatment, nursing students must grasp bone, joint, and associated tissues. This knowledge is used to evaluate patients and identify skeletal problems. First, we are going to locate the greater trochanter of the femur. So, the greater trochanter of the femur is located in the most lateral point of the proximal femur. So, here is the proximal femur, and it lies 6 to 8 inches away in the or of the iliac crest. So, here is the iliac crest, and the greater trochanter of the femur is here. This is actually easier to locate in women because they have a wider pelvis. So, like that, here. Next, we are going to locate the patella and tibial tuberosity. So, feel the kneecap. So, this is the kneecap, or also known as the patella, and palpate the ligaments attached to its borders. So, here. Follow the inferior ligament to the tibial tuberosity. So, here is the tibial tuberosity. Next is the lateral malleolus. Feel the bulge of the lateral aspect of your ankle, the medial malleolus of the fibula. Next is the medial malleolus. Feel the medial protrusion of your ankle, the medial malleolus of the distal tibia. Next is the calcaneus. Attempt to follow the extent of your calcaneus or the heel bone. Flexion. A movement generally in the sagittal plane that decreases the angle of the joint and reduces the distance between the two bones. Next is the extension. A movement that increases the angle of joint and the distance between two bones. It is also the opposite of flexion. If extension is greater than 180 degrees, it is termed the hyperextension. The third one is abduction. It is the movement of the limb away from the midline or median plane of the body. The fourth one is adduction. It is a movement of a limb toward the median of the body. Adduction is also the opposite of abduction. The fifth one is the rotation. So we have two classification of rotation. It is the internal and external rotation. Internal rotation and external rotation. The sixth one is the circumduction. Circumduction is a combination of flexion, extension, abduction, and adduction. Commonly observed in ball and socket joints like the shoulder. The proximal end of the limb remains stationary and the distal end moves in a circle. The limb as whole outlines a cone. The seventh one is the pronation. It is a movement of the palm of the hand from an anterior or upward facing position to a posterior or downward facing position. This action moves the distal end of the radius across the ulna so that the two bones form an X. The eighth one is the supination. It is the movement of the palm from a posterior position to an anterior position. Supination is the opposite of pronation. During supination, the radius and ulna are parallel. The ninth one is inversion, a movement that results in the medial turning of the sole of the foot. The tenth one is eversion, a movement that results in the lateral turning of the sole of the foot, the opposite of inversion. Is the dorsiflexion. It is a movement of the ankle joint in a dorsal direction, standing on one's heels. The 12th one or the last one is the plantar flexion. It is a movement of the ankle joint in which the foot is flexed downward, standing on one's toes or pointing the toes.